one of our brains will have the dura still intact. So that's this one here. So you can see the dura sort of cut open here. And right away you might notice these sort of wart-like structures which are located on and around the superior sagittal sinus, which would run right under here at the top of the falx cerebri. And these are the arachnoid granulations. So they're the one-way fluid valves for vessels into the superior sagittal sinus. So if I open up some of the slice here, you can see that sagittal sinus. Here it is opened up. You see sort of like a V-shaped trough all the way back from the front of the, starting from the front of the falx all the way back, and then ending up back here behind the cerebellum. And if I lift back the dura, you'll see that the arachnoid is still present on one side and not the other. So the arachnoid's present on the right and the left. It's been lifted up, and you can see into all the sulci then. So this is the arachnoid covering that would typically be present. And if we look back here, you can see the dura covering the cerebellum and this big confluence of the sinuses right here, which will come around here. It's all hollow right here, and this is the sigmoid or S-shaped sinus, and then this would continue and become the jugular vein coming out right here. So you can see the profile of the transverse sinus there. And then this is the large middle meningeal artery. So that's actually coming in through the foramen spinosum as part of, it's probably this right here coming in, as a branch of the external carotid artery. So it supplies the dura, which is a living tissue, but otherwise the brain is supplied by the internal carotid and vertebral arteries. And in this brain, the optic nerves are intact, so that's sort of a rarity. And you can see going all the way to the eyeballs. The dura is continuous all the way along these optic nerves. And as we talked about before, these optic nerves are actually optic tracts, technically, because this is the second neuron in the chain of events. So this is within the brain right here. This is not your typical cranial nerve. So the dura comes all the way to the back of the eyeball on both sides. So this brain's giving you a slightly different view than what we had with the other brains. Because of this intact dura, you've got the pituitary gland still present, which would be resting really right behind the optic chiasm. So the optic chiasm would be in here, where the optic nerves then become the optic tracts, and the pituitary gland sits right behind the optic chiasm. Here are the incoming internal carotid arteries taking an S-shaped turn. Usually we saw them cut off right about here, but in this case you're seeing those vessels a little earlier. This is dura covering, the temporal lobes, frontal lobe. Here are the ocular motor nerves, well intact, heading into the orbit to control 4 of the 6 pairs of extraocular muscles. So in this case, that ocular motor nerve is well intact, traveling just adjacent to the optic nerve itself. There's a little discoloration here because at one point this brain wasn't in fixative the way it should have been, and so we had some mold forming. So that's what the dark splotches are. And because the dura is intact in this brain, you can see the falx cerebri here between the frontal lobes, with the sagittal sinus being right on the top of that falx. You can see that right here.